All right, so let me go ahead and get into, hold on, let me see if I can find the right slide, our agenda. So ADHD and coexisting conditions, or what we call comorbidities, are more than 2/3 or happen in more than 2/3 of people who have an ADHD diagnosis. So they'll have at least one other coexisting condition. And so we're going to break them down into categories. The first category is going to be neurodevelopmental diagnoses or conditions, and that is basically how the brain develops, right? That's what neurodevelopmental means. Next, we're going to talk about behavioral conditions, developmental conditions, and some mood shifts or conditions that you may see if your loved one has an ADHD diagnosis, or if you yourself have one. We find that this is a hereditary type of thing. So if your children have ADHD, there's a good indicator that you, their other parent, biological parent, or somebody in the biological line has an ADHD diagnosis. And we do see this coming up more and more frequently, and it isn't because all of a sudden more people have ADHD than they used to be. It's because we are now screening for it more than we used to. Okay, so you may not have had an ADHD diagnosis, but as we go through some of these symptoms, you may think, oh, well, maybe I do. Or if you have a loved one who has ADHD and you've done research for them and their symptoms, you probably found yourself kind of hiding in some of those. I know I did. I have 5 children, and all 5 have been diagnosed with ADHD. So I do have some lived experience in that regard. So let's go ahead and get into the information today. Oh, let me get my notes up so I know what I'm talking about. Okay, so the first comorbidity that we are going to discuss in ADHD is autism. Okay, so more than half of the people who have an autism diagnosis, autism spectrum disorder, they also show signs of attention deficit hyperactivity disorder, ADHD. In fact, ADHD is the most common condition that's found alongside ASD in children. So about 25% of children with ADHD may exhibit mild traits of autism spectrum disorder, like difficulty with social skills or sensitivity to clothing and textures. And both ADHD and autism spectrum disorder affect the brain development and the central nervous system, and that influences movement, language, memory, social skills, things like that. These disorders do often occur together, although why is still being studied. Okay, there's still a lot of unknowns with both autism and ADHD. We know a lot more than we used to, but we're still working on getting all the facts right. Let's see here. So both of these disorders can impact decision-making, impulse control, focus, social interactions, particularly in boys. Although I would kind of as a sidebar suggest that this may be more of a cultural thing, an expectation that we have that's different for boys than it is for girls. Usually we see girls kind of hiding their symptoms, managing them, masking them more so than boys, just because the culture expectation for girls is a little bit different. So medication is often used to treat ADHD, and it can help manage the symptoms like hyperactivity. However, when treating children with both ADHD and autism spectrum disorder, medications like stimulants might be less effective, and they can actually result in more side effects. Social withdrawal, maybe they're more irritable than they used to be once they start that medication. And so it's really essential that we find the right treatment for each child, okay? So here's some statistics about autism spectrum disorder as it co-occurs with ADHD. So the prevalence is 1 out of 4. So 1 out of every 4 children is going to be diagnosed with autism if they have ADHD. So some of the symptoms: over-focused, unable to shift attention, which, you know, that's very much a hallmark of ADHD. A low tolerance for change. So I'm probably going to reference children mostly in this presentation, but it's also true for adults. But if you have a kiddo and, you know, say they were expecting to go to grandma's after school, but then grandma's not feeling well, so it got canceled. And so they get home from school and you say, sorry, honey, but grandma's not feeling well, we can't go. And they have a very low tolerance for that information, right? They get very upset about that. So that's what that means. Highly sensitive or insensitive to light, noise, touch, pain, smell, or taste, so sensory disruptions. They have food preferences based on color or texture. So this is a big one in my house where my kid has to actually look at the food before they know if they're going to eat it or not. It's not about if they're hungry or if they ate it a million times before and they liked it. If they don't look at it and it feels appetizing, they will not eat it. And they often have a hard time remembering detailed facts. So how do we treat this? So behavioral therapy is very helpful in this, but a lot of these co-occurring these comorbidities you're going to see is going to include a lot of parent training, and that really just means telling you as the adult, as the parent, as the guardian, um, how you can manage these symptoms. Okay, so it's not really about stopping them, it's about how do you respond to them. Okay, skills training to cope with daily life. Medication for ADHD symptoms or irritability can be helpful. And then there are some dietary therapies that you can use to eliminate nutritional gaps. I know my doctor told me that avoid anything with red 40 if we can, which we know it's pretty much in everything, unfortunately. But red 40 does have a tie to some of these exacerbating symptoms. All right, next, learning disorders. I'm not sure why my screen keeps giving me this. There we go. There's some kind of thing in this presentation that's supposed to move around, some kind of animation, and I'm not going to mess with that. So it keeps giving me the play button. Okay, so learning disorders. So the prevalence of learning disorders is 1 out of 2. Okay, so this is very common, and that just means they have trouble with processing information. Dyslexia happens a lot with people with ADHD. Also dysgraphia and dyscalculia, or dyscalculia, I'm not sure how you pronounce that. And that's just difficulty in reading, handwriting, or mathematics. Okay, so those can be very prevalent for people who have ADHD. And so we can always talk with the school system, if they're in public school or even private school, about learning modifications or accommodations, special needs or special education services. A lot of you who have kiddos in the school system may have an IEP, and that's kind of how we navigate some of these disorders, these learning disorders, is through specialized education and accommodations. And that could really just be something simple as you know, they don't have a time limit on how long it takes them to do a test, like the other kids may, okay? Or maybe they don't have homework where other children may have homework. So it can be something very simple, doesn't have to be an entirely modified curriculum for them. It can just be little accommodations here and there to make it easier for them so they don't get all that anxiety and that stress. Next, speech problems. This is a prevalence of 1 out of 10, so this isn't as prevalent as some of the other learning disorders, but it does happen. My oldest child who has ADHD, she struggles with stuttering, and she's almost 20 years old and she still struggles with it. And so what are some symptoms? So issues with word or sound pronunciation. And this, of course, is not like normal, right? Like the, or I shouldn't say normal, but the typical development of a child learning how to form their words, right? Where they get some things mixed up. We're talking about beyond that stage, right? Where they're still struggling even after they've maybe reached the threshold of what we consider typical. Studying articulation. So maybe they mumble. I have my youngest one mumbles all the time, and it frustrates her to no end when I ask her to slow down. But I have to hear what she's saying. I have to know what she's saying. And so she does struggle with articulation. And so you can do speech therapies if it's becoming problematic, if it's prohibiting them from fully being able to communicate that they want to communicate. So treatment options are really just speech therapies and just that consistency. Next, Tourette's syndrome. Let me change this here. Okay. So Tourette's syndrome and ADHD often occur together. Over half of the children with Tourette's syndrome also have ADHD, and about 1 in 5 kiddos with ADHD will experience Tourette's syndrome or other tic disorders. And a tic disorder is just sudden, quick movements or sounds that they really can't control. And they may try to hold them in, but it eventually comes out. Okay? And they are common in childhood, but they usually fade as they grow up. And we find that boys are 3 times more likely to have tics than girls. And again, we're not sure if that's a genetic component or if that is a social type of thing, right? So a tic can be either simple or complex. So a simple tic would just be like quick movements of one muscle group. And a complex tic can be multiple muscle groups, okay? Um, so how do we manage Tourette syndrome? They typically need treatment only if they're causing significant issues. Okay. We don't want to shame our kiddos. We don't want to make them feel weird or abnormal. If it's not really bothering them, if it's not causing a lot of disruption in class or what have you, you probably don't have to stress about treatment options. But if they are causing problems for them and the peers that they're around in class or what have you, you can do different interventions. Okay, so that could include behavioral interventions and or medication. And in milder cases, just reassurance and education can be beneficial. Okay, just letting them know it's not something that they're doing on purpose, it's not a big deal, that kind of thing. Okay. So the prevalence is 1 out of every 10 children, but more than 2 out of 3 children with Tourette's have ADHD. Okay. Um, so there could be motor tics, like I said before, where they're just kind of moving around, or vocal tics where it happens where they're, maybe making a sound, coughing, grunting, that kind of thing. Let's see here. So there is a popular approach called Comprehensive Behavioral Intervention for Tics, or CBIT. And this is really just an increasing the awareness of tics and their triggers, right? So a kid could say, I know when I'm nervous, this happens, or I know when I'm excited, this happens. Okay, so just being more self-aware. And then you can teach competing behaviors to use when feeling the urge to tic. Okay, so maybe they have a vocal tic, and you can say, well, when you feel that being triggered, here's something you can do instead. Okay. And then just making small adjustments in their daily routines to help reduce tics, right? If their tics are anxiety induced, or if their tics are transition induced, right? Just knowing where they're coming from and why they're happening, or when they're more likely to happen, that can help you make those minor adjustments to reduce the frequency of them. Okay, so with the right support, of course, as always, children with tics or Tourette syndrome and ADHD can thrive. Okay, this is not a life-limiting disorder. Of course, there are some extreme cases where it can be, but most cases it's not. All right, so next we're going to move into some behavioral or disruptive disorders. So this one I think is very important to really nail down, because I think sometimes when people look at these disorders like ODD and conduct disorders and things like that, they automatically assume this is a disciplinary issue, right? And in some cases, they are kids who are just misbehaving for the sake of misbehaving, right? But I want you to know that there are actual disorders that cause some of these behaviors. And so we want to kind of eliminate the stigma through education. Okay, so I hope that this helps. So disruptive disorders, they include something called oppositional defiant disorder, or ODD, and conduct disorder, CD. Okay, these are going to be diagnosed in childhood. Okay, you will not usually find an adult who is diagnosed with ODD or CD. Okay, those are going to be different diagnoses. So we're talking about just children here. And so the children who have these disorders, they might struggle with authority, right? They might say no just because you told them to, right? Which does very much seem like disciplinary issues, and it can be, again, but we're talking about the disorder here, okay? And so they might have angry outbursts. They may engage in lying behaviors or stealing. And oppositional defiant disorder, ODD, will often precede conduct disorder as children grow older. So if you have a child who has oppositional defiant disorder, as they get older, it could be relabeled or re-diagnosed as conduct disorder. Okay. So ODD is characterized by patterns of negative and defiant behavior that last at least 6 months. Okay, because we all know that children naturally, normally, and healthily push boundaries. They challenge boundaries, right? They need to know where the safety line is. Okay, so we're talking about these are behaviors that are at least 6 months or longer. Okay, so to be diagnosed with ODD, a child must display at least 4 of these following symptoms, okay? Frequently losing their temper, arguing with adults, refusing to follow the rules. They're annoying people on purpose, okay? And sometimes kids do that whether they have a disorder or not. Some kids just think it's fun. But again, we're looking for at least 4 of these symptoms, okay? They're blaming others for their mistakes. They're angry and vindictive, okay? Showing that spiteful behavior. And again, this is prevalent. 1 out of every 2 children who have ADHD will be diagnosed with this ODD, okay? And so these behaviors, they have to occur more often than in their peers, okay? So if everybody's being a butthead, it's probably not a disorder. But if your kid's the only one out there being a butthead and this is happening for longer than 6 months, that might be something worth looking into, okay? And this also has to impact their social, academic, or work life, right? So maybe they're getting in trouble at school so much that they can't focus on the academics. Maybe they've lost all their friends because of this behavior, okay? That's when we know it's maybe something more than just normal childhood angst, right? Let's see here. Around 1/3 to 1/2 of children who have ADHD also have ODD. And again, boys are diagnosed with both disorders more often than girls. Children from divorced families or lower socioeconomic backgrounds may be more affected. And children with a combined type of ADHD, so that could be hyperactivity and inattentive, that's combined, they are more likely to have ODD, okay? So again, understanding these behaviors, that's how you support your kiddo, right? It's not always a disciplinary issue. Now, of course, discipline may take place in this space, but we also have to do that under the awareness that this is a disorder, okay? So it's not something that they can typically just shift. So how do we treat it? Medication is an option. Counseling, of course, is an option. And again, behavioral therapy for the parent training, okay? How do you approach this in a way that's going to de-escalate and not make things worse, okay? And I think that, most of the time, whether our child has a diagnosis or not, I think a lot of parenting is really just getting over yourself and learning how to meet your child where they are. And so I think it's great that this is actually part of the treatment option, is just kind of letting you get squared away so that you know how to respond and react. It's good parenting either way. All right, next, conduct disorder. So this is going to have a prevalence of 1 out of every 4 kiddos who have ADHD. They're going to be diagnosed with conduct disorder, okay? So this is going to be serious behaviors like aggression towards people or animals. Maybe they're destroying property, they're lying, stealing, skipping school, okay? So these are often described as delinquency, okay? So again, remember, ODD is for the little ones and conduct disorders for the ones who are a little bit more older, okay? And I have a nephew who was diagnosed with both of these, okay? So I know how this plays out. It can be very, very frustrating. So if your little one is struggling through this disorder, I know you're struggling right along with them, right? Let's see. So children who exhibit these behaviors, they should receive an evaluation, okay? A comprehensive evaluation by a medical professional or a therapist, social worker that's licensed, that kind of thing. And children and adolescents with ADHD and conduct disorder, they often have more difficult lives and poor outcomes than children who just have ADHD alone, as you can tell. But there is treatment, okay? But here's some of the others. Here's some more symptoms I want to read off the slide for you. So we've got lying, truancy, skipping school, stealing. Maybe they're always getting in fights, hitting people, biting people even. So again, it's important for you to understand as their guardian, their parent, their caregiver, that children who show symptoms of ADHD and ODD or CD, they should be assessed for both types of problem behaviors, okay? You should know that you don't have to manage your child's diagnoses alone. Getting support through interventions like parent training or even at-home behavioral assistance at school, that can make a difference, okay? So don't hesitate to ask for help. And I know there can be a lot of stigma around this, like, well, my child doesn't behave, my child's fighting, my child's skipping school and he's stealing, right? And then people are going to look at you and say, well, you just didn't raise them right? Or you didn't discipline them enough, right? But there are people who understand that this is a disorder. There are people living with this disorder, with their children. And so it's very, very helpful to seek out those spaces so you can find that community, okay? And there are some medications that can help, but of course there's counseling and parent training also as first line defense before you go the medication route, because you don't always have to do that. All right, so now we're going to shift into mood disorders. So mood disorders, they can be kind of scary, especially if you start looking into some of these more depressive ones, right? Because that's not something that they really grow out of, and it can come back in cycles throughout their entire life, okay? So this happens 1 out of every 5 kiddos who have ADHD, and also adults, but again, we're talking about kiddos. And so it can be missed that when someone has both bipolar disorder and ADHD, they may not be diagnosed with both, right? It can take up to 17 years to diagnose bipolar disorder. Okay, I have a nephew who has ADHD and was diagnosed when he was younger. And then when he hit 19, he was diagnosed with bipolar disorder. Okay, so it does happen. And again, there's a lot of a hereditary component to a lot of these too. So of course, like any 2 conditions at the same time, it's very important to get the right diagnosis as soon as you can. Okay, especially with bipolar disorder, it can be really scary. And so it's really important for the doctor to see if someone has someone who has bipolar disorder, if they also have ADHD, and it can exacerbate it, right? So having bipolar disorder is bad enough. I shouldn't say bad enough, but it's a challenge. And then when you layer that with ADHD, it becomes even more challenging. Okay, so doctors should always look for both. If they have one, they should screen for the other. And the research shows that people who have both ADHD and bipolar disorder, they have more severe ADHD symptoms, and they get bipolar disorder earlier, and they have other mental health problems compared to those who only have ADHD. Okay, so it can be very, very complex. But people who have both ADHD and bipolar disorder are usually male, and many of them also had conduct disorder or oppositional defiant disorder when they were younger. Okay, so you can see kind of a pattern where they're younger, it's ODD, and then they get to adolescence and it's conduct disorder, and then they get to their adult life and it's, oh no, this is bipolar. Okay, so remember, the people in these studies were not found early, and they had problems with many years without the right diagnoses. Okay, so it's really important to find the problems early and get the right treatment for each problem, right? There's no magic pill that's going to fix everything. But if you get the right medicine, the right therapy, you learn how to manage your life well, you can live a good and healthy life. And again, I'll use my nephew as a reference. He is doing much better than he did in his adolescence. He's in his early 20s now, and he's a homeowner. He's got a great job, but he's learned how to manage his diagnoses, and he's very much independent and happy now. So there is always hope, right? All right, next, depression. Okay, we all struggle with depression, or at least the blues, right? From here and for every once in a while, here and there. But if you have ADHD, especially if you have grown up without knowing that you had ADHD or without any skills, right? You didn't learn anything to help you manage it. Depression can creep in pretty quickly. Okay. Over time, children who have ADHD, they may become frustrated and demoralized because of their symptoms, right? Especially if people don't understand ADHD and they think you're just being defiant or you're just being lazy or you're just, whatever it is, right? They absorb all of those labels and they kind of infuse them in their identity, right? So then they start to tell themselves, I'm lazy, I'm no good, I can't figure it out, I'm stupid, right? Even if those aren't the words that are being told directly to them, the implication is there, right? If people don't understand ADHD. So the prevalence for depression is 1 out of 10, which might seem kind of low, but if you think about, a room full of 100 kids and 10 of them are depressed, I mean, 1's too many, right? So kiddos who have ADHD, they may develop feelings like their lack of control of what happens to them and their environment. They might become depressed as they experience repeated failures or negative interactions at school or at home or in other settings. Why didn't you just do your homework? I told you to do your homework. Why were you just in front of the TV, right? And so these negative experiences accumulate. That child with ADHD may begin to feel discouraged, right? And then these symptoms with ADHD first appear, or the ADHD symptoms will appear first, and then the depression comes later, because the depression is almost a response to how the world around them is responding to them. Okay. So negative reactions are common in individuals with ADHD, and some experts claim that up to 70% of those with ADHD will be treated for depression at some point in their lives. Okay, so again, we can think about gender differences. Oftentimes, young boys are diagnosed with ADHD way earlier than girls. Sometimes girls aren't even diagnosed until they hit college age, because they're kind of conditioned to maintain a certain social expectation, right? To be quiet, to be, smiling, polite, what have you. They don't get to be as disruptive as young boys do. And so they hold a lot of it in, they mask a lot of it in. And so then when they get to their young adult lives, the foundation starts to crumble, right? The stress of life, the stress of college, the stress of being an adult is just too overwhelming. And that's when they start to seek out help, and they think, oh, wow, I got ADHD. I had no idea, right? But by that time, depression has already taken root, right? So let's see here. In addition to being sad or demoralized as a result of ADHD, children may also experience true depressive illness, right? So it's not just situational depression, it could be a clinical diagnosis. And so studies indicate that between 10 and 30% of children with ADHD may have a separate serious mood disorder like major depression, okay? And the overlap of symptoms will make that major depression, mood disorder more difficult to diagnose, right? So for instance, having that hyperactivity or that physical agitation, poor concentration, those are symptoms of both ADHD and depression, right? So if a child has those symptoms and appears to also be sad, hopeless, or suicidal, your doctor may consider a diagnosis of major depression, okay? And these are complex situations, but it is important to see a psychologist or a psychiatrist to diagnose and manage that condition, okay? And in the instance of depression in children with ADHD, it can also be affected by the presence of other coexisting conditions. So in children with ADHD and they have ODD or CD, of course, the depression rates are going to be substantially higher, right? Because their behaviors, their expressions of that disorder are disruptive and people don't understand. And so they think it's like a personality or a character flaw, right? When it's really just a disorder. And so when people don't receive it and understand it, they're going to respond differently, right? All right, let's keep it moving. Other disorders, anxiety, right? Anxiety is very common in children and adults who have ADHD. The prevalence is 1 out of 5. And so the symptoms are worrying a lot about everyday things, right? Sometimes people worry about worrying. They feel on edge and stressed out, overly tired, right? Sometimes it's just really exhausting to be in a state of anxiety all the time, right? Your nervous system is ramped up and it's flooding your body with cortisol, and maybe you're hitting some of that fight or flight and you're tense all the time. That's really exhausting. And so even if you're not doing anything, if you're just sitting there in your anxiety, I mean, that can make you tired, right? So how do we treat that? CBT, cognitive behavioral therapy, is pretty much the go-to for anxiety, pretty much across the board, whether you have ADHD or not. It's a really effective treatment plan, and most clinicians are very skilled in this space, but it's always good to ask and make sure that if they're offering treatment options, they know cognitive behavioral therapy, they've been trained, okay? And then of course, individual therapy and medication if those other options don't work for you. Or you can do both, right? Medication and therapy. That's often usually what happens. It's usually not just one or the other. Next, sleep disorders. This happens 1 out of every 2 kiddos who have ADHD. They struggle with sleep. I know mine do. Mine are up all hours of the night. They sleep all day. Some of that could be just normal teenager stuff, but they do struggle with sleep, and it's not uncommon. So some of the symptoms, trouble falling asleep, trouble staying asleep, right? That's a big one. And being sleepy all day. I know my kiddos will be like, I'm tired all day long. And then as soon as the sun goes down, they're wide awake, right? And they don't know why. So many children and adults who have ADHD will also have a sleep disorder. Almost 3 out of 4 children and adolescents, and up to 4 out of 5 adults with ADHD. Okay, so not getting enough sleep, needing to sleep at times that don't mesh with school or work obligations, obviously that could have significant long-term effects on your life, right? If you can't sleep at night and then you have to get up at 6 o'clock to get to work, and then, but you didn't get to bed till 4:30, that's going to definitely impact your day, right? And so some other long-term effects that can come out of having a sleep disorder: physical illness, right? We all know what it's like to not get sleep over a long period of time. You really start to get run down. It can affect the way that they behave, right? Maybe they're irritable and they're snapping and they're angry, right? And then mood changes. And so while adults may seem obviously tired when we're behind on sleep, fatigue in children can often look like exaggerated ADHD symptoms. So an exaggeration of hyperactivity, an exaggeration of their impulsive behaviors. Sometimes even they're aggressive and acting out, right? You don't realize, well, they're just tired, right? Because they're bouncing off the walls. How could they be tired? They've got all this energy. So just keep that in mind. It could look different in children than it does in you. And so people who have ADHD, they often have trouble sleeping. And we think it might be because ADHD disrupts that natural sleep-wake cycle known as the circadian rhythm, okay? So when that happens, it's really hard to fall asleep at the usual time. Or sleep can be constantly interrupted with waking up during the night, right? Their body doesn't realize it's nighttime, you need to be asleep, right? It's backwards. And so, of course, that can make it really hard to wake up on time, you get to the bus, to feel alert. And of course, we all know what that looks like. You can't get your kiddo out of bed, and then it's, you're frustrated, they're frustrated, you're late, and that just sets the whole tone for the rest of the day, right? So it's just going to kind of build on itself, right? But people with ADHD, they often do feel more awake in the evening than in the morning. And that's different than people who don't have ADHD, right? And so for young kids who have it, it can be hard to wind down at the end of the day. They might have trouble stopping activities or stopping the thoughts from the day, and that rumination kicks in. And that can make bedtime really challenging, right? You tell them to lay down in the quiet, and all they can hear is all the things that they did wrong during the day kind of spinning through their head or what have you, right? So these aren't really concerning behaviors, but they can be frustrating if they happen every night, especially if it's disrupting the sleep for you and them, right? Nobody's getting a good sleep, then nobody's going to be in a good mood in the morning. So that can be really frustrating. So we really want to focus on sleep hygiene. Okay, so that's just really good sleep habits. Stick to a scheduled bedtime and be mindful. How much sleep does your kiddo need? They, our teenagers especially, they need 10 to 12 hours of sleep, but they don't often get that, right? So we just want to make sure that we're using good habits. We've got a good bedtime that makes sense for our schedule, but also makes sense for our biology. Keeping a bedroom environment comfortable. I know a lot of times, especially like the teens will just kind of want to lay in their bed all day and kind of bed rot. But we want to discourage lounging and spending a lot of time in your sleeping space. We want it to be designated for sleep. So that way, when they get into that space, their body's almost queued up to be able to rest, right? Get plenty of exercise. Right? Exercise doesn't have to be going to the gym and, deadlifting 400 pounds. It could just be, walking. It could be dancing, which is one of my favorites. It could be taking a hike, or even just doing some yoga or stretching. It doesn't have to be really, really rigorous. Monitor eating times, having that routine again. And if that doesn't work, talk with your doctor. They may be able to prescribe something for your child, or even for you if you're struggling with the sleep, that can be helpful. All right, now let's go into substance use disorder, okay? So this is prevalent in 1 out of every 10 people who have ADHD. And this is just when your kiddo or, your adolescent, or maybe you yourself kind of starts to do what we call self-medicating, right? And they get into drugs, alcohol, tobacco, things like that, to kind of take the edge off of their symptoms. And so it does typically happen quite by accident, right? They do something to make themselves feel better, and then it becomes a habit, and it becomes an addiction, and then they're abusing these substances, okay? So what are some symptoms to look out for? Behavior changes, right? Irritable, depressed, nervous, inattention, which again, that could be ADHD, right? So you have to be really, really attuned. Restlessness, loss of coordination or change in gait, like the way they walk, Maybe they start hallucinating. Maybe they've got pupil dilations or blurred vision. Of course, this is when they're probably actively under the substance effects. Heart palpitations, shakiness, sweating, or chills. This could be a symptom of withdrawal. Sleep problems, change in appetite. Okay, so we're looking for a change in appetite, not, well, my kid never eats or my kid overeats. That could be something that they've done prior to using a substance, right? It might not be an indicator that they're using a substance, but in combination with some of these other symptoms, it may be worth looking into. And then experiencing withdrawal symptoms when trying to quit. Okay, so maybe your kiddo has experimented with some things, but then when they, stop using it, it doesn't really have a big effect on their body. But if they've been using it for a while and then they try to stop and they have those withdrawal symptoms, that's an indicator that it is a substance use disorder, that they've been doing it for a while and they probably got hooked on it. So what are your treatment options? Well, there's inpatient and outpatient treatment with trained professionals, okay, to get through, if necessary, a detox or give you therapies and give you that support, even with other peers can be very helpful, okay? So there's options for you. This one I thought was incredibly fascinating. Hypermobility syndromes. So hypermobility, it's when a person's joints have an unusually large range of movement. Okay, you've probably seen people online where they can kind of twist their limbs all kinds of weird ways, and you think, how are they even doing that, right? How does that not break their arm, right? That could be a hypermobility syndrome, okay? And it can cause pain and lead to dislocations, subluxations, or subluxations. That's such a weird word. And that just means where, maybe they're always turning their ankle, or maybe they're, always dislocating their shoulders or something like that, right? If this is causing somebody pain along with other symptoms like muscle stiffness, fatigue, reoccurrent injury, then that's what we consider a hypermobility syndrome. Okay, so if you dislocate your shoulder or if you turn your knee or something like that, it might not be a syndrome, but if it's constantly happening and it hurts and it's causing, all these other symptoms, it could be a syndrome. So some of the symptoms: pain and stiffness in the joints and muscles, clicking joints, like you can hear when they're moving, joints that dislocate, that's just coming out of that correct position easily, extreme tiredness, they're always spraining themselves, always hurting themselves in some way. Digestive problems can also be a symptom of hypermobility syndromes. Frequent dizziness and fainting, or thin or stretchy skin. That is also a telltale sign of Ehlers-Danlos syndrome, I think is how you pronounce it, which I have a niece who has that too. So the link between ADHD and hypermobility does raise some questions about how the brain's executive functions affected by ADHD interact with the body's motor control, okay? So the main symptom of ADHD, like inattention and hyperactivity, may affect the person's muscle tone and coordination, potentially causing or worsening joint instability and hypermobility. So there's research out there that explores ADHD-related neurological patterns and how they affect physical stability, and also consider how physical symptoms of hypermobility might influence attention and activity levels. And that affects their neurological states, right? So basically it's saying that we're researching, like, how does, maybe being a little bit more hyper and maybe more clumsy or not paying attention to what you're doing can actually exacerbate these hypermobility syndromes, okay? So some of the, sorry, somebody's mowing. I'm sorry if you got that got loud. So living with hypermobility disorders can often mean managing other comorbidities, right? So there is dysautonomia, which is the digestive system being affected, POTS, chronic fatigue, pain, or gastrointestinal challenges, and also visual stress, okay? So there's a lot that can go into this type of syndrome. So how do we treat it? Maintain a healthy lifestyle with a well-balanced diet and keep a healthy weight to support joint strength. Okay, a lot of times we can implement nutritional change to kind of counteract some of the symptoms and all of these disorders, right? Um, Sleep hygiene, right? Having good sleep hygiene, of course. Engaging in low impact activities like swimming or cycling, so that way you can get that exercise that your brain needs, that your body needs, but you're not overstraining your joints. You can have supportive shoes for ankle stability, which is a really good idea. And then if you do hurt yourself, if your kid hurts themselves, you can use heat or ice to reduce swelling or to soothe those joints. And of course, rest and elevate any injured joints for recovery. All right. And I believe that is the end of my presentation. Yep. So there's my contact info. If you're interested, if you need to reach out to me. And then, of course, the alabamarespite.org website has a bunch of information on there, has all of my recorded trainings on there, and upcoming trainings as well. I try to get those out by the last week of the month. So if you get on there, you don't see anything brand new, just give it a little bit and I'll post it up there soon. And then, of course, I always want to give you guys my sources to inspire you to do some of your own research and get some more education outside of what I was able to provide for you today. So I stopped my share. Thank you so much for sticking in with me. Let me go ahead and stop my recording.